Topic of today is maternal care. These are the lecture objectives. So the maternal care is studied together with the child health and refers to a package of comprehensive healthcare services which are developed to meet, uh, promotive, preventive, curative, and rehabilitative needs of pregnant women before, during, and after delivery. The independent needs those children from birth to 5 years. The aims of these is to reduce maternal mortality and morbidity, reduce perinatal and neonatal mortality and morbidity, regulate fertility so as to have wanted and healthy children when desired, provide basic maternal and child health care to all mothers and children, promote and protect health of mothers, promote and protect physical growth and psychosocial development of children. The components of the maternal and child health include maternal health, family planning, child health, school health, handicapped children, care of children, patient satisfaction, care. So each and every day, 1,000 to 1,600 women die needlessly during pregnancy and childbirth. Many are under risk before and during their pregnancy. These women often lack information and appropriate voluntary services for family planning. Many women lack information and services during the pregnancy and receive inadequate health care support during and after delivery. So the women continue to die at the rate of one every minute of every day due to preventable causes related to pregnancy and childbirth. A woman's death during childbirth often means death for her newborn. So this is the ratio of maternal mortality, which is one of the highest. In fact, it is the third highest in the world. So the nutritional interventions that can be done can be direct or indirect. The direct can be supplementary feeding programs, iron and folic acid tablets, or fortification by fortification and enrichment of food will prevent against the neural tube defects in the children. And then indirect intervention includes control of communicable diseases. This is important for fetal growth, birth weight, and nutrition during infancy. Then prevention against infections will also very necessary. For example, rubella, syphilis, malaria, UTI, deadly smoking, heavy work, psychological stress. So this is also very important component. Then there are a number of reasons of maternal mortality. The leading of which is hemorrhage, mostly due to postpartum hemorrhage. Then hypertension, indirect causes, and other causes as well. So ideally, at least 2 to 4 visits are recommended during entire pregnancy. The first visit should be made within 12 weeks of gestation and the childbirth and pregnancy should be registered. And the second visit is recommended between 14 to 26 weeks. Then third visit is recommended between 28 to 34 weeks and fourth visit is recommended from 36 weeks onwards. So ideally, 13 to 14 visits are recommended from first to 7th month. One visit is recommended every month. Then in 8 months, 2 visits are recommended. And then 9 months onward, one visit is recommended every week. So the antenatal checkup includes history taking, which includes questions such as complications during previous pregnancy, calculating the expected date of delivery by asking for date of first day of last menstrual period and by adding 9 months and 7 days to it for calculating expected date of delivery. Then history of any current or systemic illness, for example, hypertension, diabetes mellitus, then family history of hypertension, diabetes, thalassemia, twins pregnancy, and any drug allergies are asked. Then physical examination is done. For example, for anemia, if there is pallor, it indicates anemia. The site for examination includes conjunctiva, nails, palm, tongue, and which are examined. Then for edema, it is found in association with high blood pressure and proteinuria. It may result in preeclampsia, predispose the patient. And the sites include face, hands, abdominal wall, and vulva. It can be due to a number of reasons: high blood pressure, cardiovascular diseases, proteinuria. The pulse is checked, the respiratory rate is checked. The normal is 18 to 20. Then blood pressure, if there is high blood pressure, it may signify pregnancy-induced hypertension. And if there is proteinuria plus 2 albumin along with high blood pressure, it may suggest preeclampsia. Reading should be taken at least 4 hours apart between the blood pressure readings. And if the systolic BP is more than 110, this is not systolic, this is diastolic. But if the diastolic is more than 110, it is in the sign of feminine eclampsia. Then the mother should gain at least 12 kgs during pregnancy. And if there is inadequate dietary intake, then the weight gain will not be adequate. So this is the breakdown of weight gain. During the first trimester, 2 kg weight is gained. During the second trimester, 5 kg, and during third trimester, 5 kg. So the low weight gain indicates intrauterine growth restriction or low birth weight of the infant. And if there is excessive weight gain, then there might be twin pregnancy or diabetes mellitus, so which requires further assessment. Then breast examination is also recommended for any pathologies. Then fetal heart sounds are assessed and it are audible after 6 months. 120 to 140 beats per minute. Fetal movements are felt after 18 to 22 weeks. Fetal line presentation are assessed after 32 weeks. There are different types, for example, breech, normal, transverse lie, and from 36 weeks and onward, preparation of labor and mode of induction should be discussed. And if your uterus is larger than estimated, gestational age, or if there is palpation of multiple fetal parts, then multiple pregnancies suspected. Then in the abdominal examination, fundal height is checked, which, as the picture indicates, is at different levels. At 12 weeks, it is at the pubic symphysis. At 20 weeks, it is at lower border umbilicus. At 36 weeks, it is at the sternum. Then further in the abdominal examination, there is an inspection of abdominal scar, an assessment of gestational age done by ultrasound and from date of last menstrual period. Then the lab investigation at the sub-centers, pregnancy test can be done, urine pregnancy test, and hemoglobin CBC can be done, urine test can be done for assessing urinary tract infections or risk of preeclampsia. And then rapid malarial tests are also done. So these are the different tests which are done in first, second, and third trimester. The first trimester, an ultrasound is done. CVS sampling is done between 10 to 13 weeks. In the second trimester, alpha-fetoprotein is done during 14 to 22 weeks. Amniocentesis is done between 15 to 20 weeks. Then in third trimester, another ultrasound is done. Then at primary healthcare center, blood grouping can be done to arrange for blood during the delivery. And then VDRL is recommended for checking sexually transmitted diseases. HIV is also tested. Then blood sugar is also tested by oral glucose tolerance test. Then for hepatitis B screening, hepatitis B surface antigen is also checked. Then tetanus toxoid is provided for prevention of tetanus. The first of which is recommended as soon as the women presents in the clinic. There are 2 doses given at least 4 weeks apart. If delayed at any time in pregnancy, then it should be provided during the delivery. And RH status should be confirmed, and if the child has negative, if the mother has negative blood group and the child is positive, then anti-immunoglobulin should be given at 28 weeks of gestation. Then prenatal genetic screening for hemoglobinopathies, Down syndrome, and neural tube defects should be done. Then there is risk approach in certain patients. For example, if the woman is less than 19 years of age, there is a grave risk to both mother and the child because the teenage mother is still not adequately equipped to cope the pregnancy and labor and is not psychologically capable for responsibility. Then if the mother is too old, if she is 30 years and over, then it leads to increased risk of complications in pregnancy and labor. Then having too many babies, when the mother bears more than 3 babies, she is at high risk of developing problems due to repeated pregnancies and labor. This is due to weakening of tissues, depletion of nutrients, and overall poor physical health. And having 2 close pregnancies, less interval between 2 pregnancies, less than 3 years, it can create problems because mother did not get enough time to recover completely and fully from the stress and strain of previous pregnancy. The other condition for risk includes mother with short height, less than 145 centimeters, having small and inadequate pelvis results in pelvic disproportion, mother having less than 40 kg of weight, underweight or malnourished, anemic, and have high risk of developing complications, mother having more than 70 kg of weight have difficulty, then mothers having malnutrition and anemia. These mothers are weak and find it difficult to tolerate the stress and strain of pregnancy. Then if there are associated medical conditions, including heart disease, high blood pressure, kidney disease, TB, diabetes, repeated attacks of malaria, hepatic disorder, these are also high risk approaches. Then what is suggested to as antenatal advice, registration of pregnant women. The mother must be registered within 12 weeks of pregnancy. And about the antenatal visits, ideally the mother should attend the antenatal clinic once a month during the first 7 months, twice a month during the 8th month, and thereafter once a week during the 9th month. And the special care of women should be done during pregnancy to promote, detect, and maintain health of mother, to remove anxiety, to detect high-risk pregnancies, to reduce maternal and infant mortality and morbidity. Mother should be advised to avoid smoking and drinking because it leads to low birth weight and retardation. Drugs, mother should be advised not to take any medicine unless and until it is prescribed by a doctor. And about the radiation, the mother should be advised to avoid abdominal X-ray because it predisposes to high risk of leukemia and other cancers. CT scan is absolutely contraindicated. Any expected mother should be instructed to protect herself from risk of infection, especially measles and syphilis, because infection can cause spontaneous abortion, malformation, mental retardation, stillbirth. And coitus should be avoided during the first and last trimester because it increases the risk of abortion. And then last trimester predisposes to infection. Then traveling should be avoided during first and last trimester to prevent DVT. Then if there are any untoward signs and symptoms, the mother should be advised to report. For example, if there's unusual pain, bleeding from vagina, swelling in the feet, hand or face, headache, blurred vision, dizziness, high fever, baby movement not being felt, all of these should be immediately reported to the doctor. Then the mother should be educated on various aspects of childcare. About the follow-up with the visits, mother should be educated about the needs of for follow-up visits and proper care during pregnancy. And specific health protection is recommended for anemia, nutritional deficiencies such as iron, folic acid, and prevention against tetanus, syphilis, German diseases, RH status, HIV, mental and psychological preparation, family planning. Then the specific measures done are provision of iron and folic acid supplementation for at least 3 months. 400 microgram folic acid are recommended each day. And the mother requires additional calorie intake during pregnancy, which is 350 kilocalories per day. Then vitamin D and calcium supplements are also given. 120 milligram iron and 2800 microgram folic acid provided weekly throughout the pregnancy, beginning as early as possible after conception. Then the natal care refers to care during confinement birth of a child. The objectives of natal care are to prevent infection, preventing injury to both mother and baby, to detect and deal with any complications, antepartum and postpartum hemorrhage, prolonged labor, malpresentation, prolapse of cord, to resuscitate the baby and to provide immediate care. The antenatal care includes preparation of place and surroundings of confinement, preparation of equipment and supplies, physical and psychological preparation, examination of physical condition, abdominal palpation, fetal heart sound monitoring, observation of vital signs, labor pain, uterine contractions, conducting safe delivery, watchful about any problem, and helping mother in taking painkillers, referral of mother in case of any problem, giving immediate care to mother and baby after delivery, giving instruction to mother and attendants, family members, maintaining record and reporting of birth to authority. Then there is another option available at home birth, which is called domiciliary midwifery. It refers to care given to mother and baby at home rather than hospital by registered midwife during antenatal, prenatal, and postnatal period. Then normally in the event of normal general delivery, the mother can be discharged 48 hours afterwards, and the baby's crib is kept by the side of mother, which enhances confidence of mother and bonding. Then about postnatal care, it is also very important for the overall well-being of the mother and child. It includes breastfeeding, which is recommended exclusively for 6 months, and then for another 2 years. Say after 6 months, weaning is started, but the breastfeeding is recommended for 2 years in total. Then family planning, intrauterine devices, and non-hormonal contraceptives are recommended during the first 6 months. Lactation also offers some protection against conception. Then during the first 6 months, additional calorie intake is required, 600 kilocalories per day. And from 6 to 12 months, 520 kilocalories per day is recommended. Then family planning, intra-uterine device, and conventional contraceptives are the choice during first 6 months. So about the postnatal care, it refers to care which is rendered to both mother and baby after delivery, the objectives of which are to restore, promote, and maintain health of mother and baby, promoting breastfeeding, prevention of complications, establishing good nutrition of baby, prevention of infection, and identifying health problems, support and strengthen the parents' confidence in their role within their family and cultural environment, and to motivate for planned and small family norms. Educate mother and family on various aspects of mother and child care. After the baby is born and placenta is delivered, it is very important that the mother is made comfortable and watched for any complication. Fundus is well fitted, clots are expressed, and fundal height is measured, and perineum is inspected for any laceration or tear. Perineal care is given. The mother is then made comfortable by removing the soiled linen through cleaning and by keeping her warm, hot drink is given after vital signs are recorded. It is very important to give regular and frequent visit to postnatal mother when the delivery is conducted at home. The healthcare is expected to follow under the schedule provided. During each visit, following actions are performed: observation of mother and surrounding to assess overall health status, observation, temperature, pulse and respiration, examination of breast, involution of uterus, loci, pertaining for any kind of abnormality, observation of any abnormality in abdominal like painful and hard abdomen. And it should be seen that the mother takes nutritious diet, takes sufficient rest and sleep, keeps herself clean and protects herself from infection, breastfeeds her baby. Then what could be the complications? Purpural sepsis could be seen, which is an infection of the genital tract within 3 weeks after delivery. The symptoms of which are rising temperature, pulse rate, full swelling, low-fear, tender abdomen. Then thrombophlebitis, which is infection of veins of like associated with varicose veins. Then secondary hemorrhage, vaginal bleeding from 6 hours to the end of 6 weeks after delivery to the end of perfusion. Then what is the three delays model? And why do the women die? So it offers an explanation. The three delays model stand for delay in decision to seek care, delay in reaching care, delay in receiving care. So delay in decision to seek care includes factors such as lack of understanding of complication, acceptance of maternal death, low status of women, social-cultural barriers to seeking care. Delay in reaching care could be due to mountains, islands, river, poor organization, and delay in receiving care could be due to supply issue, lack of personnel, poorly trained personnel with punitive attitude, and financial issues. This is the pictorial representation of the three delays model. So it is the target of Millennium Development Goals to improve the overall quality of life in worldwide of United Nations Charter to reduce the maternal mortality by 3/4 between 1990 and 2015. So what is maternal death? A maternal death is the death of women while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and the site of pregnancy, from any cause related to or aggravated by pregnancy and its management, but not from accidental causes. So this is the maternal mortality ratio, which can be calculated by number of maternal deaths in specified period upon number of live births in same period into 1 lakh. This is the maternal mortality ratio. The maternal mortality rate is number of maternal deaths in a specified period divided by number of women of reproductive age into 1,000. So this is the safe motherhood, which is recommended for prevention of mortality and morbidity to reduce the maternal mortality ratio. It stands on certain pillars, which include family planning, antenatal care, safe delivery, and emergency obstetrics care, which can be done by providing basic maternity care to all of the women for provision of adequate family health care and equity for women. So according to needs, the treatment should be provided. So these were the interventions on antenatal care, nutritional support, personal hygiene, immunization, education on delivery and care of newborn, identifying high-risk pregnancies, emphasizing the antenatal care visits and maintenance of antenatal care, importance and management of lactation, and advice on birth spacing. That's all.